Our first tipping point tonight after 8 years, is this Obamacare repeal bill from the Republicans really the best they can do? After all that campaign rhetoric, all the opposition, don't they have a better solution prepared? The mandates, individual and employer, will be repealed in this bill. Obamacare taxes dramatically scaled back. Health savings plans implemented to help people plan ahead for health emergencies financially. But the Obamacare state exchanges remain. The subsidies that have caused this whole death spiral, they aren't going anywhere. They're just changing names. The Republicans now call them tax credits. And the Democrats are capitalizing on the rift within the GOP. One faction, including the White House, supports this bill. The other faction, led by Senator Rand Paul, dubbed this bill Obamacare Light. Take a look.
We welcome President Trump's and Secretary Price's support. We will continue working closely with them and our colleagues in the Senate to get this bill passed into law. Let me be clear. Our plan is the first step. Under our plan, we are moving forward in a positive direction to rescue the individual insurance market and give flexibility to our states.
The House bill that's been put forward is Obamacare Light. It won't work. Premiums and prices will continue to spiral out of control. In fact, they acknowledge it in their own bill by putting an insurance company bailout, $100 billion at least in insurance company bailouts, because the marketplace is still broken.
With me now, former Chief of Staff for Senator Mike Lee and current president at the Sutherland Institute, Boyd Matheson. Boyd, good to see you.
Hey, good to see you, Liz.
All right, Boyd, let's start with this question of the day. It's been 8 years, Boyd, under President Obama. Not quite that entirety of the time Obamacare was passed, but Republicans knew health care reform, as President Obama called it, was coming. This bill, Boyd, this Obamacare repeal bill from the Republicans, is this really the best they can do? No better solution that they've prepared the last few years?
Yeah, it's really stunning in its miss of the mark. I always say that the Republicans have found a way to make people like something that they hate, and that's by offering them something worse. You know, it's like my kids and their broccoli. They complain about the broccoli until you bring the Brussels sprouts out. And I think we've got some people looking back and saying, well, maybe Obamacare is not so bad with the way this thing has been rolled out. And sadly, it's not doing what everyone promised they would do, particularly the leadership in both houses of Congress on the Republican side. They've got some major selling to do, not just to deal with the Democrats, and we can get to that in a minute, but they've got a lot of Republicans who are less than happy with what they're rolling out and really don't believe that this does justice to the American people.
Right, and count me as one of those Republicans who's not happy with this bill. I mean, when you have a bill like this, when you have such a major, quote-unquote, achievement, as President Obama calls this, you need that contrast. You need a solution, an alternative that you can look 4 years down the road. You can look back and compare how people's lives were under Obamacare versus how people's lives will be, the quality of their health care under the new Republican version. And not even for election reasons, but just so people realize how it impacts their lives, I don't think this bill is going to provide that type of contrast.
I think you're absolutely right, Liz. And I think the important thing for Republicans to think about is that I think this is one of the last chances the Republican Party will ever get to prove that they are the party of the little guy, not the lobbyists. And everything that I've seen so far in this bill, the way it's been communicated, the fact that they're trying to cram it through exactly the way the Democrats did in 2009 shows that they're far more interested in what's in the swamp already with the lobbyists and the big business and the crony capitalists than they are about really protecting the little guy. And the only way we can ever get to really serving the little guy is to go from not Obamacare or Trump care or Paul Ryan care. We need to get to state care and get those decisions and dollars as close to the people as possible.
Right, and I couldn't agree more. I mean, even in places like Massachusetts, which of course Governor Romney instituted Romney Care, he was widely criticized for that, but states are the place to do that. States are the place, they're supposed to be the laboratories of democracy where we try single-payer healthcare, where we try totally free market, where we try different things and see what works for the people. That's where it's actually constitutional to have those kind of experiments, not from the federal government, not telling us that we'll be penalized via some so-called tax if we don't buy healthcare that the government approves of. Boyd, I do want to wade into this swamp, though, before we get too far into this segment. I want to wade into the swamp and talk about what's right about the bill versus what's wrong about the bill, because it's not entirely bad. It does repeal the mandates. It does keep people with pre-existing conditions will be able to get coverage. They can't be denied. It allows dependents up through age 26 to stay on their parents' insurance. There's some Medicaid rollbacks in a way that makes sense. And then there's also there's health savings accounts, which help people individually save for their emergencies rather than relying on the emergency room or government here. But the part that is mind-boggling to me is the $100 billion bailout for insurance companies. It pretty much, in my mind, cancels out the good stuff.
Yeah, and you really just described what a legislative process should look like. So rather than having these fake fights and false choices of we have to do everything or you can't do anything at all, we have to do this one at a time, very specific, make people debate, defend, and vote and be accountable for if they think that the mandate's right, make them vote on that. If they think having people on until they're 26 is the right thing, great, let's talk about it, debate it, vote it. But neither of the Republican leaders seem interested in having any debate or amendments to this process. And this is part of the challenge, Liz. They're trying to convince the American people that we're too divided to deal with the issue. Because if they convince us that we're too divided, that gives Congress the excuse to do nothing. It gives the president the excuse to do what he wants with an executive order. And the people who suffer are the poor and the most vulnerable among us. And so we have to get past this. And that's the thing I hope that everybody in Congress and that everyone will call and tell their member of Congress that we need votes, we need amendments. We ought to throw them all on the floor of the House and the Senate and lock the dang door and make them talk about it with the American people,
Right.
not an empty chamber, and then have real votes that matter, votes of substance on specifics to the bill, and that's how you get good health care for every American.
Right, and it also holds our elected officials, our congressmen and our senators accountable, because if they have to state on the record for their constituents to see, to hear, and to read exactly how they feel about each of these measures, they're going to be a lot more careful about what they repeal and what they leave in place and exactly how this is done. I agree with you 100%. There's great divide in our country. I don't think anyone on either side of the aisle is going to disagree with that, but at the same time, I mean, this was one of the key components of Donald Trump's campaign, the repeal of Obamacare. I mean, you heard how many times he called it a disaster. I got sick of hearing how many times he called it just terrible, even though I agree with him. The American people agreed with him. There's a reason the Democrats lost over 1,000 seats across the country during Obama's tenure. They don't like it. Republicans need, with all due respect, they need to be a little more courageous about this and do it all the way.
That's right. I think the Republicans are making a very interesting calculated gamble right here. And sadly, I think Leader McConnell is making this all on politics. And when, working for Senator Lee, we always had the motto that good policy is always good politics in the end. We have some people in Washington who don't seem too interested in the policy component. They're more interested in the political power and the influence that they can have. It's why, most of the richest counties in America are suburbs of Washington, D.C.
Right.
For a reason. And so I think the American people have to demand that. As you said, people voted for disruption and a challenge to the status quo. And if the Republicans think they can just skate along because they have control of all three branches of government, that's going to make 2018 a very interesting midterm with lots of challenges. And again, I think there's so many areas of agreement that we can get to. And whether it's healthcare or immigration or anything in between, there's a lot of things we can work with and from. But you have to have people. This is not about being able to do it. A lot of people are trying to sell, well, they can't do this through reconciliation. The Senate can make this thing happen. It just takes 51 senators to pull the trigger on that. And nobody should be confused or misled that they're paralyzed and this is as good as we can do.
Right,
Because
it's not. It's not. I mean, that's a cop out. If anyone who has any idea how the Senate works knows that's a cop out. I mean, they haven't even addressed how they're going to pay for it, where they're going to get the money, or if this is even sustainable, which we knew Obamacare wasn't. There are so many questions. Boyd, we're out of time, so if you could answer this very quickly, I want to get this question. What's going to happen from here? Is the White House going to change their mind? Is Congress going to pass this? Are they going to restructure it completely? What's going to happen?
I'm hearing that the White House is willing now to tap the brakes a little bit. They've been hearing from people like Mike Lee and Tom Cotton and a host of others across the political spectrum who are saying, hey, if we're going to do this, let's get it right. We don't have to get it fast, but we do have to get it right or we've missed the chance of a lifetime.
Right, and you can still do it. You can do it right and do it fast enough to get it in before the 2018 midterms, which is important. Boyd, we're out of time. Thank you so much for being here, sir.